Hello, and welcome to this episode on distance calculation between vocal folds in high-speed video using Glottal Analysis Tools. Glottal Analysis Tools developed by Erlangen University Hospital, Germany. Software developed for endoscopic use with integrated high-speed cameras for a detailed insight into the voice formation of patients. Glottal Analysis Tools is used to evaluate the recordings of high-speed video. This is continuously being developed and used worldwide by several research groups in a clinical environment. This software from Erlangen has many parameters for voice analysis. Our high-speed video setup by Richard Wolf records with speeds of 4,000 frames per second. We present two high-speed videos recorded with our equipment of a normal and a laryngopharyngeal reflux patient, played back in slow motion. This allows for detailed evaluation of glottis. With high-speed video, we can evaluate laryngopharyngeal reflux patients, and in some cases, an insufficient closure in the rear is visible. Glottal analysis tools allow for a digital reproduction of glottis in pixel. In the analysis, it is possible to view a cross-section of a selected part of the glottis in pixel, as presented here for a normal subject. Trajectories allows for the evaluator to choose a specific cross-section of glottis ranging from 0% to 100%. 0% being the absolute rear of glottis and 100% being the front of glottis. We have selected the middle of glottis by setting the trajectories to 50% and 10% from the rear part of glottis by setting trajectories 10%. Our reason for choosing 10% was to quantify the insufficient closure seen in the rear of many laryngopharyngeal reflux patients. The same analysis is presented for a patient with laryngopharyngeal reflux. The movement of glottis is reproduced digitally in pixels. The video on the left shows the movement of glottis in the middle with a sufficient closure at trajectories 50%. The video on the right shows the movement of glottis in the rear with insufficient closure at trajectories 10%. A high-speed video and trajectories 10 and 50% of a normal subject is presented. Notice that both 10 and 50% trajectories shows sufficient closure of glottis. A high-speed video and trajectories 10 and 50% of a laryngopharyngeal reflux patient is presented. In this case, only trajectories 50% shows a sufficient closure of glottis. At 10% trajectories, there is a clear insufficiency that is also visible on the high-speed video. The clinical implication is that after treatment, the rear part should close sufficiently. This is important for many speakers and singers. This is a collection of digital reproduction of glottis in the middle and in the rear, showing the maximum and minimum opening of 4 normal subjects. Note that the trajectories shows a sufficient closure for all subjects. This is the rest of the 20 subjects that were randomly selected for statistical analysis. Note that the movement of glottis is similar between subjects. As for the trajectories, this is mostly the case as well. 4 out of 20 laryngopharyngeal reflux patients randomly selected for statistical analysis. Notice the insufficient closure of the rear part of glottis at trajectories 10%. and they all close at trajectories 50%. This is the rest of the 20 patients. The pattern varies. Some patients partly close in the rear for a part of the examination time. This method of reproduction on pixel level of the glottis is interesting, and any percentage of distance from the rear part of glottis can in principle be chosen, not only for laryngopharyngeal reflux, but also for nodules, polyps, and malignancy. This gives exact information on the glottis at a selected precision in pixels that can be used for quantification. The trajectories can be extracted, but are a proprietary format that can only be decrypted by the developers at Erlangen University Hospital, whom it is possible to contact for information. Thank you for watching.